What is the IUI?
Placing a processed semen sample directly into the uterine cavity by a fine catheter is called IUI.
What are the indications for IUI?
The common indications are unexplained infertility, endometriosis of grade 1 and 2, and endocrine disorders such as anovulatory PCOS, hyperprolactinemia, thyroid disorders, obesity, and in male factors such as mild male factor infertility, when the total motile sperm count is between 5 to 10 million, and erectile dysfunction, and cervical factors, and in patients with a single patent fallopian tube, and when the sample is frozen, we can do IUI.
On which day we should visit the hospital to start the IUI?
A patient should come to the hospital on day 2 or 3 of cycle for the basal scan, and the drugs started on that day, and a follicular monitoring should be done until the dominant follicle reaches the size of around 20 and 22 mm.
When is the IUI done?
IUI usually done almost 36 to 40 hours after the trigger.
What will be the procedure on the day of IUI?
On the day of IUI, the couple should come 1 hour before the procedure timings, and husband should give a semen sample. After 30 minutes, we have to check for the liquefaction, and 10 microliter of semen sample is seen under the microscope for sperm count, motility, and morphology. For this patient, we use a density gradient method. Here we have to take a clean conical tube and layer with 1 ml of 80% density gradient media, followed by 1 ml of 40% density gradient media and 1 ml of semen sample. The seal is centrifuged at 1400 rpm for 15 minutes. After centrifugation, remove the supernatant and transfer the pellet to the sterile centrifuge tube. Add 3 ml of sperm preparation media and mix with the pellet. Again, centrifuge it at 1000 rpm for 5 minutes. Remove the supernatant again and mix the pellet with 0.5 ml of sperm wash media and load into the catheter and place gently into the uterine cavity.
When will you do the single and the double IUI?
The first IUI 24 hours after the trigger, and second one 36 to 40 hours after the trigger.
Time requires to take rest after IUI.
Around 15 to 20 minutes of rest is required after IUI procedure.
How many cycles we can try with the IUI?
Almost minimum 3 to maximum 6 cycles of IUI can be tried. And after IUI, we have to provide a luteal phase support for 15 days, and we have to check for the results. Thank you.